What is peripheral arterial disease and what are the risk factors?
Any artery in the peripheries, that is the upper or the lower limb, if they get blocked slowly or acutely, that is known as peripheral arterial disease. What are the risk factors? The risk factors in the books are four. First and the foremost is diabetes mellitus, long-standing diabetes, uncontrolled diabetes. Second is smoking. Smoking means that nicotine use in any form, be it chewing or smoking or PD or cigarette or hookah or any format. If the nicotine is going in the body, it will lead to slow atherosclerosis. The other factor is hypertension. Hypertension, uncontrolled again, or a long-standing hypertension causes atherosclerosis. The fourth factor is lipids. Lipids means cholesterol. If the cholesterols are deranged in anybody's body or diet, the other three risk factors might not be there. But if the lipids are deranged, that also leads to atherosclerosis. Some chronic blockages which may turn acute and cause symptoms of peripheral arterial disease.
What are the common symptoms and treatment options available?
If a clot has formed, the symptoms are very dramatic. It's like acute onset of severe pain, coldness in the leg, black color which is deepening by the hour. The patient is not able to walk or move. These are the symptoms of acute peripheral arterial disease. If we talk about chronic diseases, chronic is when slowly these symptoms are developing. There is no clot, but a plaque. For that plaque, the symptoms are that food is not eaten. In layman language, gangrene, that there was a black color which slowly progressed by some small trivial injury or tight shoe or the nail cut was not fine, and the gangrene started and it is spreading gradually over a period of days to weeks. The other things are claudication, wherein the patient walks and he has to stop because the calf or the thigh starts to pain. He has to stop, regain the blood circulation and then start walking again. So this is known as intermittent claudication. There may be rest pain, which means that patient is gradually having pain slowly, specifically in the foot, not above. The foot is discolored, it is cold, and continuous pain is there, not relieved by normal painkillers.
Which patients are eligible for an endovascular intervention?
All patients are eligible for endovascular interventions, but we have to decide that this patient have a life expectancy of how many years based on the comorbidities. If the patient is generally having some coronary artery disease or renal problems, old age in which these things are developing, then we have to choose endovascular options. Otherwise, surgical options are also there, which are in the long term are having good patency, and we prefer to use open or endovascular depending on the profile of the patient.
What is your clinical experience on the results and present literature evidence of these procedures?
Endovascular interventions are less morbid, done under local anesthesia. You go in with a wire, do a ballooning or a stenting of that area. The patient is discharged the next day. Then we have to look at the longevity, the life expectancy, and we want the wound to heal, or what are we looking at what's our end point. That is in tandem with all the published literature, the ongoing trials internationally, the multicentric or the randomized controlled trial.
What is your message to the general physicians about managing the patients in their OPD settings post-procedure?
The mainstay is lifestyle modification. You have done a procedure, it will stay open only if the lifestyle modifications are done, only if the patient is complying to keeping his sugars under check, he is not smoking, he is keeping his hypertensive medicines, taking them regularly, not taking lipid-rich foods, and the most important thing is that he is taking his blood thinners or whatever medications are prescribed in the post-op period regularly